Hello, this is Leanne Kaiser, and this is the current event number 1 for MHA 575, Access to Care, Health Disparities, and Community Health Workers. This presentation was from an airing on CNN on 2/10/21 entitled, "This Group of Workers Could Help Turn Around Quality of Life and the Economy." Health disparities tend to be and continue to be an alarming problem in the United States. Even though it's been a focus of both policy and research, the issue of health disparity has been on the government's Healthy People 2000, 2010, and 2020 initiatives to achieve health equity and eliminate disparities. However, we still have much work to do. Healthy People 2020 defines a health disparity as a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. I thought this graphic was very powerful. It's showing what equality, equity, and justice means in a graphic, and I thought it was powerful. So Healthy People 2020 defined health equity as the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequities, inequalities, historical and contemporary injustice, and the elimination of health and healthcare disparities. So if you look at the equality portion of this graphic, the assumption that everyone benefits from the same supports, this is equal treatment. So as you can see in this graphic, obviously not everyone is equal on these boxes under equality. And then under equity, everyone gets the support they need. This is the concept of affirmative action, thus producing equity. So if you see, they've obviously, eliminated some boxes, added some boxes so that everybody can equally see the picture in the same way. And then justice, all three can see the game without supports or accommodation because the cause of the inequity was addressed. So the systemic barrier has been removed. So I thought this was, extremely powerful and explained it in a very equal and understandable method. So access to care barriers. So when we talk about access to care, like what we looked at in that previous graphic, we talk about barrier to healthcare services, including the high cost of care. So just the overall value in the dollar of care, healthcare today. And adding to that, inadequate or no health insurance coverage. So somebody doesn't have health insurance coverage or they have coverage with very high deductibles, they're leery to seek care because of that. Lack of availability of services. So some communities don't even have local healthcare facilities. Maybe all they have is a community hospital or a hospital where the care would be much more expensive than it would be a local clinic or anything, an outpatient service. Obviously, inpatient services are much more expensive. Also, lack of culturally competent care. So if someone feels like their culture is not being respected in the type of treatment they want, then obviously that's going to be an issue for them and maybe they won't seek care because of that. So I thought this was another graphic that was extremely powerful if you just look at the aspects of access to care. So clinics, medical health hospitals, preventative care, insurance patients, urgent care, the treatment of patients, clinics, hospitals, those kinds of things. So access to care issues can impact a person's overall physical, social, and mental health quality of life. So there are so many factors that come into play with disparity and access to care issues. So barriers to accessing health services lead to, number one, unmet health needs, delays in receiving appropriate care, the inability to get preventative care services, like we just talked about on the previous slide, financial burdens if they do seek care, which ultimately leads to what would have been preventable hospitalization. So in other words, when they delay care or don't seek care or don't get the appropriate health preventative health services, they're going to end up with a hospitalization that would be much worse if they had done that type of preventative care. So despite substantial efforts to minimize health disparities by programs such as Medicare and Medicaid, disparities based on economic and demographic factors remain. Researchers have discovered that a multi-tier approach for both community-based and individual support will be most effective in the change. So the use of community health workers is one example of how change can make a difference in personal lives, population health, and help break down those disparities we've been talking about. So more recently, community health workers have been thrust into the forefront with global pandemic, putting more pressure on them to actively seeking out people who have been infected. So when we talk about community health workers and how they really feel like they're going to impact these barriers to healthcare and be able to help with these unmet health needs and delays and the inability to get preventative care, that's one of the ways in which the problem can be solved. So what is a community health worker? So most people have probably never heard of a community health worker, and to be honest, I had never either until we got a federal grant to establish a community health worker program a couple of years ago at SIU Center for Family Medicine in Carbondale. These individuals vary from high school graduates to high school graduates with a community health worker certificate. There is a program out there they can get a certificate, all the way up to master's level college grads. But also the connecting factor for all these individuals, whether they be high school grads with a certificate, bachelor's, master's, that is they all have a passion for the work they're doing. So their soul, their heart, their whole spirit is into helping patients and in the communities they live in. And that's one of the criteria for a community health worker, is that they really need to be connected to the community they live in and they serve. So they need to not only know the patients who are involved, but they need to know the resources in the community that can help these patients and connect those two together, because that's all about a community health worker, is connecting those patients in need to the services that they may need and are not receiving or don't understand how to receive. So that's one of the big factors in community health workers. So if you look at this graphic kind of tells you what all a community health worker does. So, they are trusted, they're specialists, they are educators, they're advocates, they're counselors, they're outreach workers, they help that navigate the healthcare system, they do health promotion. So a community health worker overall is a trusted member of a patient's care team. They develop a close relationship with the patients in the communities they serve. And we kind of talked about that a little bit ago, but that can't be said enough, is that they literally have connections to every aspect of whether it be social services, whether it be food banks, whether it be healthcare services. So they literally are connected and plugged into every aspect of what these patients may need. So for example, the folks that we've hired over the years that have been community health workers, we've had everything from an ex-cop that has gone back to school to get his degree in social work, which was really a unique entity for us that helped us a lot with the patients who may have not only healthcare needs, but maybe they have justice issues. We were really able to tap into his knowledge of the system and how to navigate those things, which may be preventing someone from seeking services because they may be in trouble with the law, they may have a warrant, those types of things. So that was a really interesting dynamic that we had with him. And then we also right now have someone that has 2 master's degrees in other topics, but wanted a change in her life and had a huge passion for this type of work. So, we really have had kind of the gambit from A to Z. And our Springfield office has also had lots of community health workers, and several of those are high school graduates and with a large heart and a large need and a large passion for this work. So lots of different types of advocates in a community health worker. So community health workers often establish rapport with patients more quickly than do clinicians. So this is because they see this community health worker as someone that is in their community, somebody who lives in their community, works in their community, knows these patients, and feels very comfortable to speak to them and their family on behalf of these services that they're interested in and their needs. So it's something that immediately there's a rapport, there's that connection, that understanding. They may speak the language, they may have the dialect, they may look like them or sound like them. And so that breaks down a lot of those walls and those barriers that those patients have when wanting to seek care. So community health workers serve as patients, caregivers, and families through the psychosocial support, addressing health through education and goal setting, while facilitating access to healthcare services, social services, promoting adherence to treatment plans. So I think, when they talk about treatment plans, this is something where the community health worker may actually go to their visits with them, may actually go in the exam room with them to be able to kind of interpret what we all know as that medical language that is really hard for patients to understand, that communication and those acronyms that we all use every day, a patient doesn't understand, and that can dramatically impact their adherence to that treatment plan if there's a lack of understanding. And that may be through language, that may be through just an understanding level overall. Some of these patients may have difficulty with literacy, so they may not be able to read or write. These community health workers are their advocate. They're there to help them learn to navigate the system, to seek out services. For example, in a federally qualified health center, there's a financial counselor. So if somebody is uninsured, these community health workers will come in and know immediately, okay, you're a federally qualified health center, I need to get this patient on the financial assistance plan, which is based on the federally poverty guideline, and we can reduce their bill all the way down to zero if they were to qualify based on that criteria. So those are the kinds of things that these community health workers will do for the patient. So these community health worker visits often occur in a patient's home, in a community health center, in their very own neighborhood. So this is something else that they do when they're assisting a patient, is they go to where the patient is, because some folks can't leave their homes. Maybe they're homebound. Maybe they don't have the resources of a car, or maybe they don't have the ability to leave their homes. They're wheelchair bound. They don't have the ability to leave or move. So this is the largest, and to me, this is the largest part of the trust factor. They also have the ability at that point to see other social determinants of health that may be affecting this patient's health. So for example, when they go to the patient's home, they may see that the home is dilapidated, or maybe there's lots of pets, and that's triggering allergies, which is triggering their asthma. And that's why they can never get their asthma under control, is because when they went in there, they saw the amount of pet dander, which is what's triggering their asthma. So they can speak to the patient to say, the reason we're not improving your asthma is because we have this cat or we have this dog that's impacting your health care. Or maybe it's to say that your home is not safe for you. Maybe we need to be able to help you get into another facility, or to seek out additional or better housing for you. And so this is the situation where when you come to that patient's home and that patient lets you in, there's already that level of trust and that level of understanding that patient advocate in that community health worker is there to help you. So lots and lots of things that are with the trust factor in that one. So this was a really good graphic that kind of shows kind of what a community health worker does as a whole. So, it says Meet Carmen, a community health worker at a local nonprofit. They have many different titles. They work for lots of different organizations like clinics and hospitals. Even some insurance companies employ community health workers. And you see it's their patient navigator, their health advisor, their outreach worker, their community health representative, a health coach, a peer counselor. They often speak the language that their communities do. So for example, in this entity, they're speaking Spanish to the patients, and that's huge. When you sometimes don't have facilities that have bilingual services, that's huge for that patient and their level of understanding if you're speaking to them in their own language. And it's very difficult. Some of us have services that we call a phone number, and you're passing a phone back and forth. This is going to make that patient feel much more comfortable to have somebody in that room with them that's doing interpretation for that provider, whether that be a PA or a doctor or whomever, if they're doing that interpreter services and they already feel comfortable with that community health worker, they know that they're being honest with them and helping them in any way they can. So the patient engagement and encouragement are precluded by the provider's lack of time in a clinical setting. So, we all know that providers have very heavy schedules, and we know that they don't have the time to sit and explain as in depth as patients need to be able to understand their care. That's where that community health worker is going to come in. So they're going to go to that visit, they're going to understand what the provider wants, and then they're going to, at a later date, maybe in their home or in their community health center, explain exactly what that provider meant and why it's important that you take your medications and why it's important that we eat the right foods, and be able to do that additional education that maybe that provider is not going to have the time to do in that office setting. So they do the patient and family education about the environment, the eating habits, and the need for preventative care. These efforts will help with secondary prevention of disease and primary prevention of illness through both that patient and that community education that community health worker can provide for them. So sometimes we kind of label a patient as unwilling to follow health recommendations. However, it may very well be those things that we've talked about, those low health literacy, which means that leading to that difficulty of understanding and acting upon the health information that provider has given them. These patients may not comprehend the importance of their medication, their follow-up appointments, their healthy diet, or their regular exercise. That's something that the community health worker can help put those pieces together to be able to help that patient understand exactly why we need to do all of these things to be able to get to that better outcome, not just take the medicine, not just attend an appointment. It's all about the healthy living as a whole. We also have issues sometimes that may kind of have the patient's values or needs that conflict with the provider's recommendations. So maybe they don't want that blood product that the provider was recommending in a blood transfusion. Maybe that's because of a health value that they have, or a belief that they have that they don't want those blood products, or maybe they don't understand why they're not eating a healthy diet. Maybe that's that healthy diet that the provider is recommending is against their belief. Maybe they don't eat certain types of foods because of their belief. So that's something that the community healthcare worker can actually express to the provider as, look, this patient is of this belief and they don't want you to prescribe the blood product. They don't want you to talk about eating this type of food because it goes against their religion, or it goes against their values, or it goes against their belief. So that community health worker can help navigate and guide the patient through that expectation of what the provider wants versus what the patient is willing to do. They definitely can help in that role a lot. If a community health worker can help explain the medication or the treatment plan in a way that the patient understands and respects, then they're much more likely to participate in their own health care. So that's what we see most from community health workers, is that ability to be able to bridge that gap between what the expectations of the provider are versus what the expectations of the patient are. So this is basically where this article kind of talked about a lot about the community health workers' roles changed dramatically through the pandemic. They served on the front lines, they engaged public health messaging, and they've done a lot of contact tracing. So we had already kind of done that long before this article came out. Is we saw the need immediately once the pandemic had been, kind of in play a lot longer than most had anticipated. So after a few weeks, we sent our community health workers out there on the front lines to reach out to this most vulnerable population to find out, did they have the resources did they need? Could they get in the cleaning products necessary to keep their homes clean and keep them safe? Did they have the access to masks that they need to be able to go to, whether that was the grocery store or their job? Did we need to provide them basic health needs? We actually took up a fund in our FQHC to just service these patients with basic things like toilet paper and bleach and cleaners, and non-perishable food items that allowed them to be able to survive the pandemic, and especially as it stretched on and on. So they were addressing broader social and health needs within the community, and could help explain what was going on in the policy level and why it was important that they wear their mask for their own safety and the safety of the other patients and folks around them. So with the severe delays in delivering the COVID-19 immunizations, lower income folks and people of color continue to carry a disproportionate impact from the disease. So as we're rolling out the COVID-19 shot, there's been lots of literature produced recently about these folks who are the most vulnerable, those lower income patients, those patients of color, have not necessarily received their injection at the same rate that the more affluent patients have. So that has been an overall issue, and these community health workers are helping these patients navigate getting into the system to get an injection. So they're going out with laptops and they're signing these patients up, and they're taking them to these appointments to help get them their COVID-19 shot as well. So the Americans in these communities are sicker, and they're dying at startling rates from COVID-19 because of these impacts of not being able to navigate the system. So this, as well as the effects of unemployment and food insecurity, the preventative care, the social isolation that they're experiencing, as well as the alcohol and opioid use in these communities, which obviously impact the suicidal ideation that occurs in these communities. So, these community health workers can combat this overall and help in this role. So the use of community health workers has been recognized by the Center for Medicare and Medicaid Services for the Health Care Innovation Award for both the utilization of unnecessary services as well as the total cost associated with that. We talked earlier about the impact of when a patient doesn't go to an outpatient clinic for a basic service and instead goes to the ER, how much more that bill can be, especially when somebody is not insured. So, these hospitals are carrying large amounts of debt related to these services that are not being paid by any entity. So the use of community health workers was evaluated by the Center for Medicare and Medicaid Services for these awards. And 5 of the 6 programs studied that utilized community health workers saw a significant reduction in the utilization of services and the spending relative to the comparison group. So all plans had positive qualitative findings regarding the quality of care given. In 3 of the 6 programs, the community health workers adjusted the total cost of care and that ranged from $143 to $2,044 per benefit, those cost savings. So part of the reductions in spending can be attributed to averting those unnecessary ED appointments and hospitalizations when they haven't received the appropriate preventative care. So these savings suggest a strong business model for the use of community healthcare workers as the part of an interdisciplinary team, and that subsequently has a significant return on investment. So recently, congressional leaders urged the U.S. Department of Health and Human Services to direct COVID-19 and Medicaid dollars toward the use of community health workers. During his campaign, President Joe Biden promised to create 150,000 community healthcare jobs from some of America's most underprivileged and rural and urban areas. So he is indicating he will be moving dollars for community health workers to help with this initiative. So we at SIU, Center for Family Medicine in Carbondale, started using the community health workers in conjunction with Southern Illinois Healthcare, our local hospital system, a couple of years ago. And both entities are already reaping the financial and medical benefits associated with them. And again, as well as our other locations in Springfield associated with their hospitals. So we, are kind of been a little bit on the forefront of the community health worker program, and are very excited to see that now the other communities and the other entities are going to start moving toward that. So as the article indicated, SIU did have what was mentioned in the CNN article, had their community health workers delivering the food, the cleaning products, the supplies, the PPE supplies, to help protect the communities most vulnerable. So we were glad to see that, what we had already put in place was now becoming a national movement, and that we felt like we were really doing what was best for those communities. So here's the resources I used during my paper and this presentation. So I hope you found this interesting and helpful, And if any of you have any questions about community health workers, please reach out. Thank you.